Hello everyone. This is the most requested session because I was receiving many personal messages and many girls were posting in the group as well because they are confused between IELTS academic and OET. They just wanted to know what's the difference between both, which is easier, what's the pattern, and which exam they should give. So in this video, we will discuss the pattern of both the exams and then which is beneficial and which is what are the difference between both the exams and which exam they can give. So let's start. We will start with the pattern of IELTS. So this is the pattern of IELTS. In IELTS, there are four sections. First is the listening, and in listening is around 30 minutes, and there are 40 questions, but sometimes it's around 30 to 45 minutes or 40 minutes. Okay, the types of questions are multiple choice questions, diagram labeling, sentence completion, and summary completion. So the multiple choice questions that which we know, say that the MCQs, you will hear the recording and then the there will be MCQ and you have to answer that question. And then diagram labeling, it can be anything. It can be a map, it can be a workplace, and they will ask you questions related to that. And sentence completion is again the fill in the blanks and the summary completion or something. That's most of the time it's just you have to match different things that what they have talked about. Okay, what they are talking about, what they should do, so you have to match the content. In the reading, it's for 1 hour, and there are 40 questions. And in academic, if I will be just talking about academic. So academic reading is quite different from IELTS general reading. And there are multiple, most of the time it's the multiple choice questions. Hardly you will get this sentence completion. Okay, so most of the times it's multiple choice questions, long boring text, along with the sentence completion, and then matching features, and then matching headings. There will be headings, there will be paragraphs, and then you have to match that. And again, that what they have talked about in this particular paragraph, then you will match that. Writing, there will be two tasks. It will be 60 minutes, and one for task one will be a, either it can be a pie chart or a graph or a diagram or a map, and you have to write about that what you are what are your findings, what do you think about this particular diagram and everything. And you have to write around 180 words maximum. Okay, it can be more than that, there is no issues, but minimum 180. Or it's better to finish that within 180, because you have to give that more time to task 2 as well. So task 2 is the usually the essay. It can be anything, it can be about anything. Okay, it can be about global warming, agriculture, your leisure activities, anything, um, from advertisement, education, it can be anything. And speaking, it's there are three parts again in the speaking. And the first part is usually about your personal questions. Second part is they will give you a topic. There will be a topic, there will be questions, why, how, where, something like that, and then you have to talk on that topics for the 5 minutes. And then part C is related to that topic in which we have done in part B, but sometimes they do ask some new questions. Okay, so this is the pattern of IELTS. Now moving towards OET structure. So this is the OET exam pattern. It also contains, this four parts, and listening is of around 50 minutes, and there are three sections. Part A, Part B, and Part C. Part A is usually the fill in the blanks. Part B is small paragraph with an MCQ with 6 questions, and then part C is long paragraphs with 6 questions. There will be two paragraphs with 6 questions each. Reading, again, 60 minutes. It will be three sections. Part A will be only for 15 minutes, and they will contain around 20 questions, and the paper will be taken from you after 15 minutes. Then the another paper will be given to you, that for part B and part C. Again, part B is questions with multiple choice, small paragraph and one question, MCQ type question. And part C, long paragraphs with multiple choice questions, 6 questions each, and there are 2 paragraphs. Writing is 45 minutes. Okay, and in the first 5 minutes you don't have to write anything. You will just read the case notes, and a case is given. It can be a referral, letter. It can be a discharge or an update letter. Basically, you have to write to another doctor. Okay, and the speaking, it's for around 20 minutes, and there are 2 speaking tasks, and 5 minutes will be given to you, and all the tasks for the speaking will be mentioned in the card. Like, okay, fine, what you have to do next, what you have to talk uh, about with the patient, and what you have to discuss. So everything, the task will be written. Now, again, the question is that which is right for the medical professions. Either they should go for OET or they should go for IELTS academic. So there are certain factors that we have to consider before uh, selecting which English proficiency exam we should give. So let's look to the some of the points that differentiate the two exams. Okay, let's start with OET. The cost of OET is around 587 Australian dollars, and this exam is designed specifically for healthcare professionals, and it assesses your English language skills in healthcare context. And nowadays, many healthcare institutions as well as regulatory bodies in English speaking countries do recognize OET scores, such as in Australia, UK, and Canada. Okay, now if I talk about the subtests, uh, re-listening is easy because it's a medical conversation going on between a patient and a doctor, between 2 doctors, or a doctor is giving a presentation about any research, or is reading any article or something like that. So it's not that difficult for us doctors to grab the information and write, and do the questions, yeah, answer the questions of reading, sorry, the listening subtest. Now moving towards the reading module. So I will talk about part C, which is the hardest part, because many candidates do find it difficult. So I would say that the part C of reading is quite organized. The questions are in a sequence. Okay, and there is no need to read all the passages and then answer the questions. No, you know what, uh, in the question it will be mentioned, okay, fine, read that paragraph and answer this question. What doctor this is talking about, this in that paragraph, what paragraph 6 means. Yeah, it will be something like that. It will be more organized, and it will be in a sequence. So you can prepare yourself according to that. And it will also save your time if you're just taking a time in solving one question. So it will be possible for you to answer the another question in less time, because you don't have to read all the passage to find the answer. It's clearly mentioned. It's organized, and it's going in a sequence. Now talking about the writing module. So writing, the case notes is given, all the information is given. You just have to filter the information and write the letter. You just have to use the correct tense and write a letter in a proper format by using the right template and everything, and you have to write the letter. All the information is given. You just have to filter it out, select the information that is required to write a letter to the desired doctor, and then just write the letter. Everything is mentioned over there. And same is with the speaking subtest. Again, the tasks are mentioned. Okay, that, okay, fine, you will take the history, then you will ask the patient about this, okay, you will inform the patient about this, okay, now you will discuss this and you will do that. So you just have to roam around that. Just have to fill in the gaps, and just do the speaking task. So it's quite easy. OET is an easy exam. Many candidates find it very easy as compared to IELTS. The passing rate is higher, although many people do fail in this exam. I have seen many people failing in one or two subtests. So every test needs practice. Let's talk about IELTS academic. So the cost is around 410 Australian dollars, which is around 1200 to 1300 Qatari or Saudi riyals and dirhams. Um, and it also assesses your general English, including academic context, and it's not healthcare specific, and it's widely accepted for various purposes, okay, including medical studies, research, and practice. Okay, and wide range of educational institutions and programs do accept IELTS academy. Okay, so now again talking about the subtest, how it's different from OET. So again, if I come to the reading task in academic, especially the part C, I will talk because that's the hardest part. The paragraphs or the questions related to that paragraphs are not organized. One question you will get, the paragraph will be somewhere, the last paragraph, and the second question will be from the first paragraph, and they will not point you, okay, find the search the answer in that paragraph. No, you have to search it yourself. You have to read, then you have to, skimming and reading, skimming and reading, skimming and reading, that okay, find where this information will be. Okay, you will look for the keywords, and then you will just get to know, okay, find the answer is in that paragraph. So this is something that you have to practice. Now moving towards the writing subtest. Writing again, nothing is given. Unlike OET, where the key points are given and you have to write around that. No, you will just be given a diagram and a small bit of information. Okay, fine. This diagram is showing the population of this country in this year, and this is factories that has been built in this year, and that you have to write around that diagram. And the topic also for writing task 2 is that a topic will be given to you, for example, how the advertisements help you, or have you bought anything by just seeing an advertisement, and then you have to write about that product, everything around 200, 250 to 300 words. You have to write. There is nothing, the key points given to you, and you have to just write it yourself. And regarding the speaking in IELTS, the first, there will be random questions. It will be open random questions, can be about anything. Again, from climate control, agriculture, your favorite hobbies, a person you met in a restaurant, a vacation that you still remember, a place you visited recently. It can be anything, and you have to talk about it. You have to just talk about it in that 5 minutes, or you have to answer the questions they're going to ask you. It can be anything. If you are, if you are fluent in English, and you're confident enough, then IELTS is easy exam for you. And there are lots and lots of websites, such as IELTS online is IELTSonline.com, are and many others are available, where you can practice for the free material, and the Cambridge books are there to practice. Again, a proper structure and a proper guidance in speaking and listening, speaking and writing is required to clear this exam. So the question again arises, that which is better, OET or IELTS? I have personally given both the exams. For me, both the exams were of same difficulty. Yes, OET was much easier because, you know, the guidelines, or I will not say the guidelines, the keywords, the key sentences, everything was mentioned, especially in reading and speaking. That is why it was very easy to perform OET. Okay, and the context and everything was, because of my I was familiar with that text and everything. I was familiar with the terminologies, and no fancy English was used in OET. I was able to understand the text. If you are a person who love watching medical series, reading medical articles and researches, then OET will not be difficult for you. And if you are again a practicing doctor, and in a routine you write referral letters, and converse with your patients, then again the other two modules, that's the writing and speaking, will not be difficult for you. It's just related to your field, so many doctors find it easy. Because if I just talk about us, the desi doctors, we are not that good in English. Okay, so the level of English, although they assess your grammatical mistakes as well, and check the level of English, but, in writing and in speaking, you have to be 100% perfect. Okay, there shouldn't be any kind of a grammatical mistakes. Your fluency should be there. Okay, again, when writing the letter, you know, you have to avoid the grammatical mistakes. Your tenses should be perfect, so they do not create any kind of confusion to the reader. They do not create any kind of a confusion for the reader. Okay, so this is very important. English is very important in both the exams. But if I will say that, if I rate OET in terms of English grammar, if a person doesn't know much English and he doesn't have a good command in English language, then I would say that, okay, fine. uh, OET on the grade of 1 to 5 is 4. It's that easy. You can go for that OET. But again, if you're fond of English movies, read novels, and live in an English speaking country, then I think so IELTS is not a problem for you. Moreover, if you have two plans, like a plan A, the residency, plan B, the admission in the university, then I would suggest go with IELTS Academy, because it will help you in both, in achieving both your goals. Okay, it will be easy. Instead of wasting money two times, you just give one IELTS academic, and you can you can get the you can get follow the residency pathway, as well as the get the admission in the university. Moreover, it's a myth that IELTS is very difficult. Okay, I would say that it's not true. Okay, even if you just learn 7 to 8, maximum 10 fancy words, and include that words in your speaking and the writing task, then you're good to go. You can easily get band 7 in each subtest. It's not that difficult. If with practice you can ace, you can achieve your required bands, that is 7 in each subtest, very easy. You just have to use correct grammar, show presence of mind, and you should have an idea what's going around you, what what's happening around the current situation, everything. You should have idea in IELTS. If you're that kind of a person, then you can just go for IELTS. But I would suggest that before booking any exam, at least give yourself a week, study the material, and find it yourself which exam is easy for you. Many people find IELTS easy as compared to OET, because nowadays many students do complain that with the passing day, with passing time and everything, OET is getting harder and harder. The listening and reading subtest, they are getting harder, and everyone just asks me, okay, fine, what was it like? This at my time, when I gave 1.5 years back, it was easy. It was not that difficult. And I gave OET for around sorry, the IELTS around 2 years back. It was easy. Still, I'm preparing students for IELTS, and I find it very easy. It's not difficult. Both the exams are doable. Depends upon the person who is giving the exam. You just have to be confident. Okay, you just have to work under pressure. Hold your nerves, control your nerves. Avoid getting nervous. Then you know it's both the exams are doable. Both the exams are easy to get the required scores or band. I hope this helps.